Hi. So today let's talk about blood pressure or BP. So blood pressure is basically the pressure exerted by the circulating fluid or blood on the walls of our blood vessels or arteries. Now it's measured using an instrument known as sphygmomanometer. I think all of us has already seen this in a doctor's clinic, right? And it's measured in units of millimeter mercury. The normal range of blood pressure is 120 bar 80 mmHg, where 120 denotes the systolic pressure and 80 denotes the diastolic pressure. In some cases, the systolic goes beyond 120, that is, it goes beyond 130, and the diastolic goes beyond 80. In such cases, the blood pressure is termed high blood pressure or hypertension. And in some cases, the systolic comes to a range of 90 to 60, and the diastolic comes to a range of 40 to 60. In such cases, the blood pressure is termed low blood pressure or hypotension. So, first, let's deal with hypotension or low blood pressure. This can be due to a decrease in the circulating blood volume, and this might occur as a result of dehydration or emotional stress like anxiety, and immediately after blood donation, and due to underlying disorders, or even in physiological conditions like pregnancy. Now there's also something known as orthostatic hypotension. That is, when you suddenly get up from your position, you'll experience a feeling of giddiness. So this can be also due to low blood pressure. Now the most important signs are, as I already mentioned, giddiness or weakness, fatigue or dizziness, and the other important one is fainting. I mentioned fainting as an important one because there's a risk of injury due to fall after fainting. Now coming to hypertension, basically hypertension can be divided into two, that is primary hypertension and secondary hypertension. Primary hypertension, this is seen in elderly people, and this might occur as a result of loss in physical activities and poor dietary choices, and even due to alcohol consumption. There is only a gradual increase of blood pressure in these patients. Now coming to secondary, this might occur due to an underlying disorder like kidney diseases or even coronary artery diseases. And the signs include chest pain, radiating pain to your arms, numbness in your fingers, and irregularity in your heartbeat. And also, when the condition worsens, that is when the systolic goes beyond 180, nosebleeds can also be seen. Now, regarding the treatment, that is the dietary modifications. In hypertension, it's better to avoid saturated fats, and in dairy, you can use low-fat dairy, and gluten-rich food is also good. And try to avoid caffeinated drinks like tea and coffee, and also try to avoid alcohol. You can take a balanced diet, that is, give more importance to fruits and vegetables too. And regarding hypotension, there you can increase your water intake, that is, stay hydrated always, and intake a lot of greeny vegetables, and vitamin B12 rich foods like egg, meat, fishes, etc. Regarding hypertension patients, it's better to avoid salt too, or just you can minimize the intake of salt intake. And now coming to the Ayurveda side, hypertension in Ayurveda is considered as a avarana of the Vata channels by both Kapha and Pitta. That is, it can be simply stated that the Vata path is occluded by both Pitta and Kapha doshas. So here, as a line of treatment, internally we can provide them with Sarpagandha or Arjuna or Gugulu. And as a Panchakarma Shodhana therapy, we can opt for Virejana, that is purgation, and Vasti, that is enema. Now, one other thing I would like to mention is, as we are aging, and both in males and females, the normal range of blood pressure can vary. That is up to 30 years of age. In females, like 110 bar 68, and in males, 190 bar 70 can be considered normal. And also in the age group of 40 to 59, 122 bar 70 in females and 124 bar 77 in males is normal. And also in elderly, that is above 60 years of age, 138 bar 68 in females and 133 bar 67 in males can also be considered normal. So before undergoing any line of treatment, it's better to consult your physician. Thank you.